So thank you. That was what I had intended to present. I would now like to introduce some of the other speakers. We would suggest we start with, let me just find the bio that I have here somewhere. Colin Soskolne will be our first speaker to follow here. I lost it. It's got to be here. Anyway, Colin, I had already mentioned, he's professor at the University of Alberta in Edmonton, and he was working with the World Health Organization in Rome for a year, and the report that he put together is essentially what he's going to talk about. So here's the bio that I finally found. He is a professor of epidemiology in the Department of Public Health Services, University of Alberta in Canada. His career began in South Africa. He was awarded the Society for Epidemiological Research annual student prize for his doctoral dissertation at the University of Pennsylvania in Philadelphia in 1982. Shortly after his PhD graduation, he became a prime mover in focusing on epidemiology and professional ethics. His interest is in environmental epidemiology, and it stems from early work in the occupational epidemiology and in professional ethics. So I think that gives you some background of our next speakers, and I thank you, Colin, for joining us here. Yes.
If we turn things the right way around, that's a bit of an improvement. Thank you. Well, bringing notions of complexity and transdisciplinarity and systemic or holistic approaches to an audience such as this, I feel, is like bringing coals to Newcastle. However, I hope that the health spin that I'll bring to this question that Helmut has nicely introduced to us will add a further level of complexity to our concern for these issues. Now, epidemiology, which is my particular discipline, pronounced epidemiology, the study of epidemics, is the study of the distribution, determinants, and I also like to add the dynamics of disease and health in population. By distribution, we mean where diseases are occurring, and by determinants, we mean what might be causing these diseases. Epidemiology is very much an applied science that informs the public health policy process. It is the science that is therefore basic to public health. And in somehow now wedding this notion of public health to issues of the impacts, as you saw from the formula, the I equals PAT formula, I'll be giving you a slightly different twist on that in just a moment. But as you'll see from this formula, the bridging of the impacts that we as a species have on the potential to impact life on Earth is what I think is new from the report that I produced at the Rome office of the World Health Organization. And I really want to give credit to the Social Sciences and Humanities Research Council of Canada. And the head on this grant was Laura Westra, a moral philosopher or environmental ethicist, formerly from the University of Windsor. And the grant that I was a co-investigator on, among others, was called Global Ecological Integrity, the relation between the wild, health, sustainability, and ethics. Now that grant has just come to an end, and NATO sponsored a workshop last year in Budapest to try to bring this message of the collapsing life support systems and the degradation of the environment to the Eastern Bloc countries, or the formerly Eastern Bloc countries, and the book just came out last week, as a matter of fact. For anyone who's interested, it's called Implementing Ecological Integrity, Restoring Regional and Global Environment and Human Health. A final book for the project is not given on this particular transparency, so to not distract you. The final book is coming out by Island Press and should be in the mill in the next month or so. And that is the final project, the book on the project on global ecological integrity, as funded by SHRC. Now, I mentioned that I would give you a slightly different twist on this formula of I equals PAT. We use the formula global ecological disintegrity as being a function of overconsumption, population growth, and the inappropriate uses of technology. And throughout what I say to you, most of this is driven through human activity. Now, the role of epidemiology, as you'll see in the abstract in your book, the role of epidemiology, I believe, is very strong in trying to address this issue from a public policy point of view. If indeed ecological integrity is declining, if time is going along this axis and ecological integrity is declining, and as I'll show you in a moment, I think we have every reason to be gravely concerned about the declines that are being presented to us on a daily basis almost. From a public health point of view, as scientists, we would like to be able to inform the policy process by showing that these declines are having some negative impact, that disease or death rates or rates of well-being or not such well-being are indeed showing a negative display, that they're getting worse. This type of model would be what we call a non-threshold effect model. What we fear, though, is that because of the absence of necessary data and sensitive enough data to show human health impacts as a consequence of global ecological disintegrity, that is the degradation of life support systems, that a threshold model may in fact be the only one that we have time to see operating, in that we will maintain very low levels of disease and death rates that we've attained in the developed world today, and that suddenly when ecological integrity reaches such a point of decline that in fact we will see a sudden dramatic increase in the rates of death and disease. Now, we would like as public health people to try to avoid this red line scenario and develop measures that will in fact be able to inform policy as we go along. Now, why do we say this? It's very anthropocentric. Well, we believe from a public health point of view that this has a certain resonance with the public, and the public are the people that vote the people into power, in whose back pockets certain influences might be or might not be, and that this can in fact be something that we could impact if the public could be informed. So we need to have access to data that will help us better determine what the impacts are. Now, in the interests of time, I will just say very briefly that the epidemiologic method most of you might be familiar with is that of randomized controlled trials, clinical trials testing drugs, whether one drug is better than any other. But in fact, there are quite a number of techniques in the non-experimental field that epidemiologists use. And these are cross-sectional studies, case-control studies, cohort studies. Well, in fact, even before we get to doing this lower-level type of study, which we call an observational study, which usually draws on its data from what we call the natural experiment. For example, if people smoke, we follow them up for 30 or 40 years and we see what the consequences of smoking would be on these people. Before all of this happens, there are what we use to develop our hypotheses in epidemiology, and these are called anecdotal reports. And I submit to you that epidemiology is now faced with the challenge of enough anecdotal evidence coming from the ecologists and the biologists to suggest to us that we'd better use some of our methods to try to help inform public policy. Now, the reason, as Helmut said earlier, that I was invited to speak to you is because of this report that I produced at the World Health Organization in Rome, and I have a copy if any of you want to see it. It's called Global Ecological Integrity and Sustainable Development, Cornerstones of Public Health, and it was produced in July of last year by myself and Roberto Bertolini, who's the head of the European region in the Rome office of WHO. This is the website address. Be careful of capital letters, otherwise you won't get it. It is, I might just mention to you, the most sought-after document on the European site of the World Health Organization. Now, this particular document was an attempt to bring together the notions of declining ecology and the consequences of this for public health. And what do we mean by ecological integrity? The very simplistic definition, I know, and there are people in this audience who I also know who will disagree very strongly with some of the definitions, and there's a whole discussion and debate that's ongoing with it, as there is for the definition of sustainable development. But by ecological integrity, what I'm referring to is simply the ability of life support systems to withstand perturbations and sustain themselves. And these, in turn, is what we need, are what we need to sustain human life. By sustainable development, I use the Brundtland definition of sustainable development. That is, sustainable development is development that meets the needs of the present without compromising the ability of future generations to meet their own needs. Now, if we look at the kinds of declines that we heard about earlier and that I've alluded to already, some of the colleagues that I've worked with on this ecological integrity project, the SSHRC-funded project, include James Carr, who developed the Index of Biological Integrity, Ori Laux, who developed the measure of mean functional integrity. If you set those two measures aside, because these are obviously colleagues who've been in my face and have shown me the indicators that they've developed, but if you look at indicators, perhaps I think 12 to 15 of them that were reported about a year and a half ago in the World Wildlife Fund, or the Worldwide Fund for Nature as it's called outside of North America, if you look at their some 15 indicators, each and every one of these indicators show the same kinds of declines. Now, what kind of declines are we actually seeing? Between approximately 1982, depending on the indicator and depending on the place where it's measured, but over this 15-year period, 1982 to 1997, there have been something like 50% reductions in whatever it is that these folks have been measuring. Whether it's the Index of Biotic Integrity of James Carr, Ori Laux's measure, those of the World Wildlife Fund. And if you look at William Rees's Ecological Footprint of Nations, he shows that, in fact, at current levels of consumption, we need 2.5 Earths to sustain life. And when you do a reality check, and if any one of you have looked around lately, we only have one. Now, people in policy, or people in government really, the politicians, have a terrible job because science is but one input to the policy-making process. There are many other influences that determine policy, including economic, cultural, religious inputs, vested interests of corporations, and so on and so forth. But to this question, is global change really occurring, or do we need to anticipate or make projections on some of the changes? I think I'm bringing this in because science or government people often say there's so much uncertainty inherent to science that these other inputs really need to dominate in their decision-making role. But I say to you that there is minimal uncertainty about changes associated with a whole laundry list of changes that we now see. Certainly there's scientific uncertainty, but I say the uncertainties are nowhere near as great as what some people would like to suggest. And if you consider that global ecological integrity being a function of overconsumption, population growth, and the inappropriate uses of technology, here is the list that I've just put together under these 3 different categories. Let's start at the bottom: inappropriate uses of technology, bioterrorism, international transport for disposal of hazardous wastes, genetically modified organisms and plants, nuclear accidents and threats. If we look at population growth, we hit the 6 billion mark last October, heading towards 8 and 9 billion in the next 20 to 30 years. Urbanization, with over 50% of people now living in cities that simply cannot sustain this level of development. And if you look at the overconsumption area, which we're all intimately familiar with in North America, we see the impacts being in climate change. We see extinctions increasing, loss of biological diversity, the loss of cultural diversity is accelerating, collapsing fisheries, ocean bed destruction, scarcity of fresh water. In fact, the United Nations Development Program and UNEP predict that within 10 to 15 years there are going to be wars over fresh water. Okay, in the interest of time, let me rush on. I would like to just show you an attempt at being artistic here. The reductionist paradigm. We all come, certainly in the medical sciences, and epidemiology really originated in that, but now really I like to see it more as a public health science, which is multidisciplinary. If this is the sun shining, the clouds, the light of day is up here, this is ground level, we in the professions tend to dig ourselves into deeper and deeper holes, and we fail to see the consequences of what it is that we're doing in terms of the intriguing, fascinating work that we're often funded to do. And the whole paradigm by which we function encourages this approach, so that we really fail to see the consequences of this. I had the pleasure of seeing David Rapport from the University of Guelph in Ontario with regard to the Brisbane International Symposium on Ecosystem Health, a definition of transdisciplinarity. What was intriguing to me was when I went to both Webster's and the Oxford Dictionary, there was virtually no definition that in any way came close to what I think we think about, or what you think about, certainly what I think about when I think of transdisciplinary approaches, which I think is the key to trying to address the issues. And Helmut identified this report as being something that was systems and transdisciplinary in its nature, this WHO document. And I came up with a bit of help from some of the epidemiologists with this definition of transdisciplinarity. Transdisciplinary approaches to human health are approaches that integrate the natural, social, and health sciences in a humanities context, and in so doing transcend each of their traditional boundaries. Emergent concepts and methodologies are the hallmark of the transdisciplinary effort. Now, to try to be transdisciplinary, a student of mine last year completed a thesis, Lises Werder, and it was an attempt to take traditional measures of human health that we have access to as epidemiologists, and to see if indeed there was any connection across nations in a large ecological or aggregate data study, to see if there could be any correlation between measures of ecological decline, loss of forest cover and so on, and human health outcomes. And if, for those of you that are not familiar with epidemiology, we usually have a very simple model. We look at measures of what we call exposure on the left-hand side here. Ecological integrity would be the exposures of interest, or measures that would be surrogates for ecological integrity, and see if these can be related to health outcomes of concern. And whenever you do this kind of analysis, you should be controlling for potential influences. Okay, if I could just have 3 more minutes. Helmut? Okay. Gross domestic product, in fact, in this analysis was found to overwhelm all of the associations. If one of you wants to ask, I won't have time to get into some of the other measures of societal well-being, but gross domestic product is a very, very poor measure of anything that it is that we're trying to do in this area. Anyway, I'll mention the other in a moment. The indicators of health that we examined was life expectancy, infant mortality, and % low birth weight babies. So 3 potential health indicators on the right-hand side of that equation. All of these were potential exposures that we looked at. % of land highly disturbed by human activity, threatened species, partially protected areas, and average annual deforestation. And then, as I mentioned, we looked at gross domestic product as a potential confounder, but also carbon dioxide emissions and Gini index. No time to go into what all these different variables mean. But just to let you know that, in fact, since this study was done, I've come across an economist who has shown very nicely, and this is not his showing, but others have shown it, and this is now being published everywhere, that on the one hand, the gross domestic product is shown to be increasing. All this really does as a measure is accumulate what we spend money on. So the more Exxon Valdez disasters we have, the better the gross domestic product, because the more we spend. The more people with cancer that take long-term care in hospitals, the better the gross domestic product. But in fact, since the mid-70s, this genuine progress indicator has shown declines, and its decline is beginning to accelerate as well. It would be nice if we had that as a measure. But through Lises Werder's thesis, what he actually showed was that countries that have the poorest record now of the state of the ecology, in fact perform best on these measures of life expectancy. They have the best healthy babies and so on. Look at Holland, look at Japan. These are ecological deserts in the main. Well, why is this so? If you go to the understanding, of course, the reductionist scientists would say, let's rush with that to the neoclassical economists, and let's continue with business as usual. Look how well we do when we destroy the environment. But for the more responsible economic theorists, the ecological economists, who are more responsible in my book, according to the interpretation of this kind of information, and thanks to William Rees from the University of British Columbia with the ecological footprint, this kind of A success is measured more because of trade, because rich countries can afford to have places to dump their wastes and a larger ecological base from which to draw the resources that they need for their sustenance. Now, at the end of my abstract, I do say that I'll show you a 10-year strategic framework for research and action. Because most governments plan on to the next election, they don't really think in terms of long-term planning, as we think of in terms of geological time for sure, or any kind of measurable time in terms of human generations. What I believe we need from a scientific point of view is to provide incentives for the gathering of more directly relevant data or variables to derive indicators for modeling earlier health impacts. We need to provide incentives for the development of methods capable of distilling the complex array of multidisciplinary inputs about ecosystem degradation into a risk assessment paradigm that better helps in guiding policy. We need to educate professions in the adaptation and mitigation measures needed for future projected environmental scenarios in the presence of the global change that we know is upon us. Enhance infrastructure to cope with demands under the more likely future scenarios consequent to environmental degradation. Build local, regional, national, and international partnerships for addressing both mitigation and adaptation measures. By mitigation, we mean prevention, and adaptation, self-explanatory. We need to integrate the precautionary principle into our economic, social, legal, and other thinking, and we need to revisit this framework continually as we develop new data. Now, Maurice Strong's book was referred to. I happen to have a copy. It just came out about a month ago. This is Where on Earth Are We Going? And he says, he talks more at an operational level, a remarkably visionary man, who speaks about changing governments and institutions. So he's at a higher level than what I am. Promote the greening of the market system, revamp subsidies, a full accounting for environmental costs. Anyway, I won't go through the list. You can see it. And to wrap up, okay, last one. Okay. Professor Solomon Benneter from the University of Cape Town is, in my mind, another true visionary. Says in a changing world order, we need to see more of these kinds of shifts from anthropocentrism to ecocentrism as a worldview, from defensive nationalism to cooperative internationalism, and so on. You can read that for yourself briefly. And in the world of medicine and healthcare, we will see our interests and moral outlook expand from the reductionist basis of disease to include interests in the influences of family, community, national policies, and global forces on health and human suffering. And we just want to make quite sure that from a public health point of view, this is where life expectancy is going. In the future, what are the scenarios? Is it going to keep increasing? We think unlikely. We think that we want to try to avoid this. At best, we can hope for that. Thank you very much.